Hi, Tony Buffum here with Human Cloud, live at SIA's Collaboration Next conference here in Dallas, Texas. Right now, I'm with Trevor Strauss with AHSG. Trevor, tell me a little bit about American Health Staffing Group and what all it entails and what you're doing here at the conference.
Yeah, no, well, thank you so much for having me. I'm really enjoying the conference so far. So AHSG is a portfolio of workforce companies, and so we're specific to healthcare, and our focus is really meeting our clients where they are, meaning do you have a single staffing need or do you need a true heavy workforce solution with tech and advisory services? So we serve the entire market, and we have different verticals of our company that support in different ways. So we've been in business for over 20 years. We service in all 50 states, and a lot of the focus here at this conference is really about how AI is impacting our staffing businesses as well as our workforce solution businesses. So it's just a great event, and obviously everything's all about AI these days. So excited to be here and to be able to chat with you a little bit too.
That's great. Yeah, of course, everything's about AI. So we're going to talk about that in a little bit. But first, I want to talk about that ecosystem of work solutions.
Yeah.
You know, it's not just healthcare. Lots of industries are stressed with tight budgets and slim margins. How can hospitals or health networks come up with the right combination to meet their staffing needs while at the same time keep employees and other talent that they bring to the table engaged?
Yeah, I think it's a great question. And really for us, it comes down to redefining what contingent labor means itself.
Yeah.
So as I mentioned, our focus is really meeting our clients where they are. Health systems today, since that's the world that we really predominantly live in, they have to think of new ways to be able to meet their providers, caregivers, and non-clinical staff where they are, right? And so the world has changed in regard to flexible workforce modeling, different types of shift work and gig work. And so what we look at as a company is how can we help clients really understand that the world is changing and your employees are changing. So the contingent workforce is not simply external agency staff. It is those individuals who are internally that want to be a 1099 with you. They want to go to a PRN lifestyle. Correct. They want more of a true gig lifestyle, or maybe they do want to be more of a quote unquote FTE with you, but that doesn't mean 5 days a week in a 9 to 5 anymore. It may mean swing shifts. It may mean working 3 days a week in the different clinical care levels that they're at. And so it's all about using tech and people to meet them where they are to most efficiently get your patient care needs met. Right. And I think a lot of times too in healthcare, people don't think about the fact that those that are doing OR turns, the ones that are cleaning rooms, the ones that are making sure that the beds are ready for patients to be in are just as important as the bedside nurses, as the physicians and the providers. So for us, it's really a holistic look of how can we come in and help in our portion of that world, which is providing scheduling, which is providing the access to the staff, which is helping mobilize those internal resources to make sure patient care needs are met.
Yeah, it's so similar to what we do at Human Cloud in terms of helping organizations. For us, it's enterprises try to understand what is available out there in that workforce ecosystem. But it's been said for a long time, our biggest competitor is status quo. There's challenges in getting people to convert. And you said it a couple times, just understand the way that talent is changing, the world is changing, the talent market is changing. We've seen over the years an increasing amount of independent workers to the point where in the US it should be over 50% in the next 2 years, which is crazy to me, but it's become very much in demand. What challenges do you see when you go to those health networks and try to help them open their eyes, kind of educate them a bit to what the current state and future state of talent really is?
So I think healthcare is an extremely interesting business because the way that you said it, right, is the status quo is also our biggest challenge. Right? It's going to be too hard. Change management's too difficult, so we're not going to make a move. So I think that we've seen adoption from a staffing perspective of the portions of the world like VMSs, MSPs, those types of things. But what the typical stumbling block is not understanding that the world has changed so much. Healthcare is very unique in that we are so leading edge when it comes to care delivery or new inventions to, make people better in research, et cetera. But the labor market hasn't drastically changed in 30 plus years. And so it doesn't matter if it's this conference or it's other ones that we go to, it is always a talk about, well, how do we break through? Well, you break through by doing change management better.
Yeah.
And so it is not just about, let me buy the newest tech or plug this in and expect it to work. A lot of techs that have been tested in the labor space What's shocking when you break them down on what made them fail, it's they never talked to an end user.
Yeah.
They never talked to the nurses at the bedside about how this tool was supposed to help them. They never talked to the TA team that's in the central staffing office actually running the day-to-day, that, well, you just now brought in a platform that doesn't have scheduling, doesn't have the ability to build flow pools, doesn't have the ability to look at my local staff and identify that they're within 50 miles of my hospital and shouldn't be paid as much as somebody who's traveling in and getting meals and incidentals and everything else. So it's really just getting through the noise out there in the industry. And most times in healthcare right now, we still live in a siloed world. So you and I, you were a CHRO, you would have one view of the problem. And I, as say a CNO or even maybe as your VP of TA, I have a different view because I'm dealing with the staff that's coming in, the no-shows, the people that we had to walk, all of those things come into play. We've got to find a way to get a dialogue with everybody singing from the same song sheet.
And that's what you facilitate?
Yes.
Bring them together and you stay on through the change management, help them with, because that is so critical. And oftentimes that's when any kind of implementation falls apart because that's shortchanged. And they're just trying to get something implemented. They quickly want to start measuring the ROI when really getting all the right, stakeholders involved is going to help ensure the success long term.
Well, I think what it comes down to is you can buy an acronym or you can look for a solution, right?
Yeah.
And our industry was really built on acronyms: MSP, VMS, RPO, Total Talent Optimization, and TTO. Like, you can come up with 50 different naming conventions, but our focus at the end of the day is to have a platform that can make it as easy as possible to what I personally call as balancing the equation. When agencies are involved, our job is to make it as easy as possible for the agency to work with you as the end user, as the health system, and to give the health system that one centralized, system of truth to see the reporting, to understand who's being used, to manage KPIs and SLAs, to hold everybody accountable throughout the chain. So I think what happens in our world is you get quick to implement a strategy without looking at the overarching solution. Most healthcare systems need a phased approach. In the beginning, they just need to get a grasp around what is our external labor spend. It's been a huge drain on us. We've got compressed margins. We need to fix that. Then it moves to the second layer, which is, okay, one side of my business, maybe say nursing and allied, is in a program. My physician and provider side is still kind of out there hanging by itself. Most systems that do what I do can't manage both sides well. We can. Then you layer on top of that all the reporting, so that you as the CHRO, your CFO, your CEO can make decisions. Now you're empowered to take control of your entire workforce program.
Yeah, I feel like, so as you were talking, I was thinking, as a CHRO, oftentimes these are all in different buckets, and you can't really get the data from each of those buckets. But even if you can, it's disparate, right? It's in a different, but when you can pull that all together and get a holistic view of your whole organization, you make better decisions about where you need to invest more, where you need to pull back on investment, what shifts may be coming up that you're anticipating that you can get in front of. How are you leveraging technology? We started the conversation around AI. We're going to finish it around AI. How is that helping to deliver on those client needs and reaching that goal?
Yeah, I think there's a few interesting things. So one, at the heart of a huge piece of our business, we're a technology company with our own custom-built proprietary vendor management system. So it all started there.
Sure.
And on our journey was that there was not really a tech that truly met all the needs of a health system, all clinical needs and the ability to handle the non-clinical as well in a very effective way. So we went from there to saying, okay, great. Now that we have that, now we need reporting. And so then we built the most robust reporting system in the industry that now gives you that full picture. So that was a wonderful win. Then AI started happening.
Yeah.
And so our journey on AI has been very iterative, and we look at it as that crawl, walk, run approach. So we started out saying, okay, what's one of the biggest issues that health systems have when they deal with agencies? Invoicing errors, overpayment. So then we built tools to help us there to catch. We're catching right now over 30% of errors after human review.
Wow.
So health systems are reviewing it, and then when they come through our tool that we're testing right now, we're catching 30% of errors after you've already reviewed the invoice. So that creates savings upwards of millions of dollars for systems. Then we layer on top of that the candidate side of the experience. So now it is an agency can get real-time feedback when they're going to submit to one of your positions on how that person scores. Then from there, we're iterating to the next step, which is how do we have our own chat GPT, right? How do we
Yeah.
have our own LLM inside of the system so that you don't have to go look at 17 different reports. You can just type right in there.
Just ask your question.
What is my spend in CRNAs right now
Yeah.
across my system over the last 6 months? And it'll spit that out.
Yeah,
now that
that's
is still a bit of vision casting for us,
Sure.
but it is where we are going. So it's a very exciting time to take our core of the tech in our workforce solutions, adopt that based on client feedback to say, well, where do we go? Let's not just build something to say we built something. Let's truly integrate all of these wonderful AI tools to help the client succeed at the end of the day and make the agency's life easier. Because again, end of the day, our entire job in workforce solutions is to balance that equation. Easy as possible for an agency to work with a health system because they just don't have everything that is offered within our tech.
Well, and this is all just to make sure you get the right talent in the right place at the right time.
Exactly.
We hear that all the time, but that's not easy. And it's certainly, especially I would think in the health industry, there's so much movement, there's so much transition. Getting your arms around it and getting as much real-time data as possible only makes it better for everybody involved.
Right.
What else, is there anything else that you're really excited about right now? Maybe you've talked to other folks about it, or maybe you saw something here that inspired you. Is there anything that you just think is really cool that's coming up?
So, yeah, I mean, I just think what AI is doing is very cool because it's going to really augment and help everybody along the entire value chain of everything that we do on a day-to-day as a company, right? So as the CGO of the organization, I sit over all of our marketing initiatives as well as all of our business development initiatives. So it's really great to see the parallels and the big differences that are going to aid our company. So selfishly, there's amazing things that we can do with different agents and digital, digital workers and things that we can do to make ourselves more efficient. But at the end of the day, every investment we are making, all of our focus in this space is to help our end users on the client and the agency side. So what I'm most excited about is that our evolution on where we are taking our workforce solutions in particular is around what are we going to build that's going to make the agency's life as easy as possible to integrate with us, to be able to have speed to the clients. But then to the end user in the healthcare facilities, how do I make your job as a CHRO 10 times easier than it is today? Let's get rid of the disparate data. Let's get rid of the confusion and the silos. Let's break all that down. So now you have one system of truth. So what I love about what our company is doing is we can become not a spoke. We can become the hub that everything else can start to branch off of and give you a really, really easy to use solution to make sure that you've met your caregivers where they are, your non-clinical individuals where they are, and your agency partners where they are to get the talent you need and pull the right lever at the right time. Yeah,
that's great. And I can imagine, I love the idea of that interactive piece that makes it even easier. Like just the single source of truth has to add so much value.
Yes.
But then when you can interact with that single source of truth and you don't have to think about which report should I pull, you just ask the question, that is really exciting because that makes it incredibly easy, not only for the CHRO, but anybody that needs access to that information. Well, that's great. So anybody that wants to learn more, where should they go? How do they get in touch with you? How do they learn more about AHSG?
So our companies, so the corporate umbrella is AHSG, and so that's at theahsg.com. Then we have Trio Workforce Solutions, so trioworkforcesolutions.com, and then we also have our staffing business, AHS Staffing. So again, ahsstaffing.com. So yeah, we cover the entire gamut.
Yeah.
Basically, if you go to the
ahsg.com,
you can find the links to everything.
Yeah.
You can also find us all over LinkedIn, anywhere else that you would expect us to be, we will be. And so we're happy to serve where we can.
Well, I'm glad you're able to be here and that we got a chance to talk. Please go check it out. And thanks for joining us at Human Cloud.
All right. Well, thank you for having me. Appreciate it.
You're welcome.
Yeah, enjoy it.